So the CDC testing guidelines do end at 65. However, there really is no clear rationale for that, because we do know that providers as a whole tend to underestimate how sexually active older adults are, and there are tons of population data that show and support that older adults are sexually active, and we do know that patients do get infected even late in life for a lot of reasons. So there are a lot of people, and in our system we continue to test regardless. But if you have an adult, that you should test all the way to 75 if they are sexually active, and the HIV prevalence wherever you are in the country is more than 1%. So once you have an HIV prevalence of over 1% and you have an adult that is sexually active, there is a reason to test, because you will still find infections. And the other thing is just really asking about other risk groups. They found out that sometimes as people get lonely or as they get older, substance abuse may go up, needle sharing may happen. Again, so some of those risk reduction messages that we target at the youth really may not be happening in like residential facilities, nursing homes, or people who are just trying to cope with loneliness, social isolation, and polypharmacy, and just not feeling great about their health. So we in our health system continue to test, and I do think that for adults who are living with HIV already, we do need to talk about screening for other sexually transmitted infections and doing routine testing. And in our setting, like many settings, as part of the routine care, we do syphilis testing, urine GC, chlamydia testing, just to be able to identify other infections that the older adults may have. But I do think that ending screening at 65 will allow us to miss a lot more people who are living with HIV or newly infected after the age of 65.